GLP-1 medications have exploded in popularity over the past few years, rising nearly 600% from 2019 to 2024, and the next wave of innovation is already on the horizon. By 2026, we're expecting 3 new developments. First, we're moving beyond single-target drugs like semaglutide. A new generation of medications is hitting multiple receptors at once, dual and even triple agonists, not just GLP-1. Second, injections may no longer be needed. Oral GLP-1 drugs are now in late-stage trials, meaning you might be able to eat your Ozempic soon instead of having to inject it. And third, pharmaceutical companies are reaching beyond GLP-1 entirely, combining additional metabolic pathways to create therapies that don't just control appetite, but enhance overall metabolic health. Let's break down the top weight loss medications expected for 2026. Many of the newest drugs go beyond GLP-1. GLP-1, or glucagon-like peptide 1, supports weight loss by boosting insulin, regulating blood sugar, slowing digestion, and increasing feelings of fullness, both in the gut and in the brain. Another key pathway is GIP, short for glucose-dependent insulotropic polypeptide. Like GLP-1, GIP helps increase insulin and slow digestion, partly by reducing stomach acid. It also signals fullness in the hypothalamus, further supporting weight loss. Then there's the glucagon receptor. Stimulating this receptor ramps up thermogenesis, essentially boosting the body's ability to burn energy. But glucagon also raises blood sugar level and breaks down glycogen in the liver, which could work against those trying to lose weight. That's why the drugs targeting glucagon for obesity only activate it gently and always in combination with GLP-1 or GIP. This balanced approach avoids the blood sugar spikes seen with pure glucagon medications like Baqsimi while still delivering meaningful metabolic benefits. We're seeing a major shift toward medications that target multiple metabolic pathways at once. First came Novo Nordisk's semaglutide, or Wegovy, a single receptor GLP-1 agonist helping people lose up to 15% of their body weight. Next was Eli Lilly's tirzepatide, or Zepbound, a dual GLP-1 and GIP agonist producing weight loss of over 20%. Now, Lilly has introduced retatrutide, a triple receptor hitting GLP-1, GIP, and glucagon. Early results are striking, with average weight loss reaching up to 24%, approaching outcomes typically seen with bariatric surgery. However, this power comes with trade-offs. Early data shows higher rates of gastrointestinal side effects at the strongest doses. Survodutide is another dual-action medication targeting GLP-1 and glucagon to increase fat burning and energy expenditure. It has shown weight loss of up to 15%, and what's particularly interesting is its impact on liver health. Many patients in trials saw significant improvements in fatty liver disease, a dual benefit that could make this medication especially valuable. Amgen's MariTide, or AMG 133, targets GLP-1 and GIP, but stands out for its convenience. While most of these medications are weekly injections, MariTide is given only once a month. In a phase 2 trial, people with obesity lost up to 16% of their body weight with just a monthly dose. This long-acting design might make it easier for people to stay on treatment, though whether it will also bring down costs is still unknown. Novo Nordisk's semaglutide, Pfizer's danuglipron, and Eli Lilly's orforglipron are all GLP-1 agonists, but what makes them stand out is how they can be taken. Instead of injections, these medications come as pills you can take once or twice a day, completely removing the need for needles. GLP-1 medications are often delicate molecules, and because the stomach is a harsh environment, each pill has its own strategy to survive digestion. Semaglutide, for example, would normally be destroyed in the stomach. However, the oral version includes a special compound called SNAC. SNAC protects semaglutide and helps it get absorbed before stomach acid can break it down. Even though all 3 drugs come as pills, the way you take them isn't the same. oral semaglutide is the most finicky. You must take it on an empty stomach with no more than 4 ounces of plain water, and then wait before eating. Danuglipron and orforglipron, on the other hand, are much more flexible and can be taken with or without food at any time of day. When it comes to weight loss, we don't yet have direct comparisons between the pills, but early results give us a general idea. People taking semaglutide or orforglipron lost around 8 kilograms on average, while danuglipron trailed slightly behind at about 5 kilograms. The same pattern appears in diabetes management. Semaglutide and orforglipron lowered HbA1c by roughly 2% and 1.7%, while danuglipron lowered it by about 1.3%. All three medications share similar side effects, mostly nausea, vomiting, and diarrhea, but danuglipron appears to be the hardest to tolerate. Over half the participants at the highest dose dropped out of studies due to side effects, even though its rates of nausea and vomiting weren't actually the worst. This suggests other, potentially more serious side effects were causing people to stop the medication. Because of these tolerability issues, the development of danuglipron was discontinued in 2025. Some newer medications go beyond traditional GLP-1 pathways. One of the most promising is CagriSema, a combination of semaglutide and another drug called cagrilinotide. Cagrilinotide is an amylin analog, meaning it mimics the hormone amylin, which slows digestion and increases feelings of fullness. By pairing amylin activity with GLP-1, the two pathways reinforce each other. This combination delivers powerful results. In clinical trials, CagriSema produced an average weight loss of about 20%, noticeably more than semaglutide alone. What all this really means is that we're finally getting more options, and better ones. GLP-1 medications aren't a perfect fit for everyone. Some people don't respond well, and others can't stay on them long term. But now, with new targets like amylin, GIP, and glucagon entering the picture, we're moving away from a one-size-fits-all approach. For the first time, treatment can be truly tailored to the individual. It's a major shift in how we approach weight loss, opening the door to far more personalized and effective strategies. There's another ripple effect happening too. As these medications become more advanced, we're starting to see a real change in how people choose weight loss surgery. One study looking at privately insured patients found that from 2022 to 2023, the use of GLP-1 drugs as anti-obesity medications more than doubled, while the rates of weight loss surgery dropped by about 8.7% during the same period. Now, this is correlation, not proof of causation, but experts widely agree that both patients and clinicians are leaning toward medication more often than before. To be clear, surgery still delivers the most dramatic and lasting weight loss, and it still remains the best option for those with severe obesity or complex medical issues. But it goes to show just how drastically these drugs are changing the way we think about, talk about, and treat obesity. Hi, I'm Dr. Brian Yeung. I'd love to hear your thoughts. Feel free to share them in the comments down below. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. And if you know someone who could benefit from this, please share it with them. Finally, if you enjoy what we do and want to learn more, consider supporting us on Ko-fi, and be sure to check out our other socials as well.